ended up having a bilateral nipple-sparing mastectomy. It was actually caught early. I did get a lymph node dissection though, but I had implants, and right now, actually, I'm due to get them taken out and to get them replaced. So, and I had to get drains. When I was going through my surgeries and stuff like that, even though I didn't need chemo and radiation, it was still the pain, not being able to, do my functioning with my arms and breast. And then I had expanders. That was like unbearable pain.
It's about you and me. Let's come together, positivity. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change but
Hello everyone, and welcome to Health Talks by YWS. This is your go-to podcast to talk real-life health concerns, how it has impacted you and your community, your families, your work. We cover lots of topics. But guess what? This month is Breast Cancer Month. And for Breast Cancer Month, we are featuring a lot of self-help tools and strategies to help patients and survivors recover and live well after breast cancer. Today, we have the pleasure of Dr. Patty Horning, who is the Revital Program Director at NovaCare Rehabilitation. Welcome, Dr. Horning. Thank you for joining us this evening.
Thank you, Dr. George, for having me.
Thank you. Our next guest is Miss Katrina Shaw. Miss Katrina Shaw is a long-term breast cancer survivor who I have personally treated at Johns Hopkins Hospital. So thank you, Miss Katrina Shaw, for joining us, and welcome.
Thank you so much for having me. I'm excited to be here today.
Thank you. And our next guest is not really a guest. She is my co-host. It's Miss Tilly Mercy. And she's joining us from Puerto Rico, guys. She's on vacation, but she's here. So welcome, Miss Mursky.
Here for this important conversation. Nutrition is such a crucial part of recovery, and I can't wait to share and learn from the guests today.
Oh, thank you so much. So I want to talk to Dr. Horning. Dr. Horning, I think about Miss Katrina Shaw back in the day when she got treated. Miss Katrina, how many years now since you had breast cancer?
October 1st made 11 years surviving.
11 years, right? Yes. When I think about your journey, Ms. Shaw, the fear, the changes, you had surgery, the recovery, the pain from the surgical site, and all of that you've been through. I wish I had a place like Revital NovaCare to send you. And just hearing what Dr. Patty Horning and her team at NovaCare is doing is amazing. So I'm going to let Dr. Patty Horning tell us a little bit about the Revital Rehabilitation Program at NovaCare, who is the target population that they serve, and what they can do for breast cancer survivors.
Thank you, Dr. George. And we look at cancer rehabilitation, and what is it? And really what it is this idea of us helping individuals work on their function and help all cancer survivors achieve the maximum amount of physical, social, cognitive function during their cancer journey and then on into survivorship. And what I mean by that is that we really can kind of meet each patient where they are. So did they just get diagnosed and they're trying to make sure that they can still work as a bus driver? Oh, and what do they need to be able to do? Or are they a mother? Are they a caregiver? What are you going to need to be able to do so you can maximize your function? And then we follow people along their road. Some people's roads are shorter and longer. Some have some bumps, but our job is to guide them with their functional needs and help maximize their quality of life. So we've been fortunate to have this program. I believe now it's been 6 years throughout the country. We're in, I believe, 24 states now. And our goal is to kind of meet patients where they are in their community and then help them do what matters to them. So I've done anything from teaching someone how to box, to ski, to I pretend to be an Amazon truck driver sometimes. So we really we meet everyone where they were. I had a patient just recently who's an OBGYN, and she just finished breast cancer treatment and surgery. And we practiced delivering a baby in the clinic. So you never know what we may do when we try to help individuals maximize their function and independence.
Wow, that is amazing. It's amazing. So tell me, in terms of a breast cancer survivor,
Mhm.
let's talk from the initial diagnosis and treatment. So let's say a patient was diagnosed with a left breast mass. Based on the size of the mass, lumpectomy with radiation was offered to them as an option. And they chose that as their option, and they had radiation. So we do know we have surgical pain, post-op pain from the
Mhm.
surgical site. And we also know that radiation comes with some pain and some discomfort at the site and skin changes. What can your program do for that specific patient?
Great question, Dr. George. And I'll walk you back at different times that a person might come in. So sometimes we actually will see patients for a pre-surgery evaluation. And at that evaluation, we'll take girth measurements. So we'll look at their arm and we'll take volumetric measurements. We'll see how high they can raise their arm and lift, see if they maybe have pre-existing cervical or shoulder dysfunction or posture, and actually walk them through some exercises that will help maximize their mobility before surgery. You mentioned that this individual maybe had a lymph node or taken out or two. So we also helped educate them on the signs and symptoms of lymphedema, what to look out for, but then also what can you actually do? What does the literature say to actually help minimize the risk of lymphedema? And then often I'll see individuals after surgery and then before radiation. Sometimes you have to get into a certain position. So we make sure that they have the range of motion to be able to do it. And then what does a person want to be able to do? Right? Do they have cancer related fatigue? Are they tired? Are they stiff? Do they want to get back to rock climbing? I have a patient right now who wants to rock climb. That's their joy. And that takes a lot of upper body mobility and function and strength. And so that's what we practice. So that's a great question, but we really can kind of touch individuals throughout their journey.
Okay, I'm going to give another scenario. Let's say I'm going to let Miss Katrina Shaw tell you her story briefly about what was her surgical treatment and what you could have offered her back then.
Okay, well, I ended up having a bilateral nipple sparing mastectomy. And I was just blessed that it was actually caught early. I did get a lymph node dissection though, but I didn't have any chemo radiation. There was nothing in my lymph nodes. But I have implants, and right now, actually, I'm due to get them taken out and to get them replaced. So, and I had to get drains, and it was difficult. I probably know now what I knew back then. I know it's a lot of different like mastectomy bras and drain things and stuff, and even mastectomy pillows and everything. I'm like, what? It was a lot of other things that I could have maybe used or, when I was going through my surgeries and stuff like that. So I'm just thinking, what else could be just like now when I'm going to be getting my implants replaced. So what would you suggest as far as, so I know it's going to be like probably a week or so for recovery time. So what would you suggest as far as when I get my implants replaced? And
Absolutely. And so, what you could say too, and a lot of times what we'll often ask is a follow up questions like, are you currently working? Are you currently a caregiver? So, Katrina, was there some functional things that was important to you that you would be able to do, like drive, sleep, take care of anyone in your family?
yes. I mean, I'm not doing caregiving now, but as far as driving and working, because I work from home every day except for 2 days a week.
Okay.
So I'm on the computer a lot. Yeah.
Yeah. So sometimes we could look at is even as how's your desk set up? Is it a chair that's well supported? Do you have some pillows to help you sleep at night? Have you thought about getting some button down shirts and like how are you going to be able to put your shirts on with the drains? And what are some safe exercises you can do right after surgery? And what are some exercises maybe you want to wait till after the drains and after things have healed a little bit better? A lot of our hope when we talk about how the research shows that we help mental and physical scores is a little bit is take some of the fear out of what to expect and give individuals some real world things that they can do so that they can maximize their function. So that's probably what I'd really focus on. I'd be asking a lot of questions about, okay, so those days you go into work, what does that look like? What do you need to do? Do you need to carry in your laptop bag? Do you have to take public transportation? Are you driving? Like how's the parking lot? Like a lot of that kind of stuff. How long do you have to walk for? Like what are all those little steps that you need so that you're independent? And maybe, right after surgery is a great time to have your help and your help support make meals, right? Or get someone to clean your house for 2 weeks, or something like that. So that's a lot of the things that we really will function on. And then after surgery, when we get the pathology report and you meet with your team to talk about if there's anything else left, next, that's when we really kind of talk about, okay, what's the next step? And then finally, we do a program called Strength After Breast Cancer Program. It's based on Dr. Catherine Schmidt's physical activity limitation trial. It's a big research trial that looked at lymphedema, and is it safe to exercise? And based on that research, there was excellent studies that really demonstrated the value of strength training and the value of aerobic exercise. And so every one of our patients, once they're finished getting their range of motion and getting their stiffness and kind of getting some of those acute post-surgical, post-radiation, we transition them into restoring their function and their energy and their endurance. Because that's one of the pieces that I see sometimes is missed, is the endurance and the stamina and the fatigue. And so the Strength After Breast Cancer program is fantastic and really helping the whole body recover.
That's amazing.
I know it's amazing. It's really amazing, this program. What do you think, Miss Tilly?
I a lot of functional medicine. That's very much my approach too. I feel like all of the kind of questions you ask, it feels very at home with me, of just like, how can we overcome your barriers? What do you want to do? What do you want your like? Because I think so often the experience of going to see doctors is very much like, how do we get you well enough so you don't need to be here, you don't need to be in the clinic,
Right.
but not always taking into consideration of what do you actually want out of your health and your life. And the fact that you guys are asking those questions and not just like making sure that your patients are heard, given a roadmap to essentially achieving that is just really powerful. So I commend you on your guys' work.
So I remember back in the day when Miss Shaw got diagnosed. She was busy working, had a really busy schedule. I always joke with her over time. I say, you never looked your age. She always had it together, always color coded, everything was good. And then all of a sudden she got diagnosed with breast cancer. And everything is happening so fast. Oh yeah, you got to get it out. I got to make a decision. What am I going to do with my job? Am I able to work with my job? What would be my limitations? So I want Ms. Shaw to talk about, if she can recall back then when she just got diagnosed, had treatment, how was the day-to-day struggle with your physical functioning? If you could talk a little bit about what you experienced at the initial treatment post-op, like the first 90 days right after your treatment.
It was rough because my husband, thank goodness, he's a tractor trailer driver, and he actually was home with me because I know I couldn't lift my hands up a certain amount, and I really couldn't do a lot. And I had the drains, and it dealt with a lot of pain. Even though I didn't need chemo and radiation, it was still the pain, not be able to, do my functioning with my arms and the position because I had to sleep on my sides and my back. So of course I couldn't sleep on my stomach because of my breast. And then I had expanders, and that was painful because the expanders they had to enlarge. What was it? The expanders had to get enlarged.
Enlarged with fluid,
But,
yes.
right, with fluid. And oh my God, that was so painful to make room for the implants. Yeah, that was like unbearable pain. So yeah, it was a lot. And like I said, I couldn't drive, I couldn't lift my hands. So I was just glad to have my husband there to take off to help me because my day-to-day was really rough.
How was it for you combing your hair? Could you have combed your hair? Could you lift your hands above your head? Could you button your shirt in the back?
Now I'm thinking, how the heck did I have my hair? Because I didn't have a wig. Now I'm trying to think of what did I do with my hair? Because I know I couldn't. Yeah, because I couldn't lift my hands that high. So
yeah, you kind of reminded me, like I was telling Dr. Horning that I actually had a frozen shoulder and I had rehab, and my last session was last week. But that frozen shoulder seems similar to what you go through, right, Miss Horning?
yes.
Think about it. I couldn't lift my arm up. I couldn't button my bra. I couldn't wash my hair. I was just stuck in this domain right here.
Yeah.
And I think sometimes what's helpful is just having someone tell you what to expect and what makes sense and what doesn't. I think for many things, but especially cancer and cancer treatment, sometimes we think, well, we're supposed to kind of feel crummy, or we're supposed to feel fatigue, or we're supposed to feel stiffness. And I think to some of those, some of that may be true, but helping an individual objectify it. So a lot of times I would say, Katrina, if you said, I'm feeling really stiff, how do you feel stiff from 1 to 10? Or I'm feeling really fatigued, or I'm feeling a lot of neuropathy if you're having chemo, and helping kind of make a number. And often I'll say, if you're still feeling this fatigue, 2 weeks, I want you to let me know. Let's go get some blood work. Let's talk to nutrition. Let's make sure we have all these pieces in place, but helps to kind of know what's normal stiffness from post-surgical, or what's normal pain because our body's healing, and what's something abnormal and maybe potentially a sign of infection or seroma or some other things that are often very common. So I think sometimes that's also helpful in just giving individuals the knowledge of typical course of the treatment and what to expect.
So the other thing you mentioned, when we think, you said that you get nutrition involved, and we're thinking about post-op care and what it is the body needs to actually heal. I would like Ms. Mirsky to talk about that in terms of post-op for this breast cancer patient who just completed treatment and have drains, surgical sites, and either planning to get chemo or is in chemo. What are some of the nutritional needs that this patient will need to heal appropriately?
So, I mean, it's definitely complex and very much individual based. And also, it depends where they're at in their journey. Because I'm going to treat someone very differently who's currently in chemo versus someone who's post chemo. Because it's one of those things, like, you can't actually give a chemo patient a lot of antioxidants. You have to be very careful. Whereas after they have chemo, yeah, you want to load up antioxidants. So there's a little bit of nuance amongst where they're at in their journey. But I would say overall, things that are really important is one, hydration, which we talked about in our last podcast, is that hydration is not simply drinking water. You have to have minerals. You have to have electrolytes in there. Just start guzzling down your water. Yes, I love you guys all drinking. All right. Then I would say someone who is going through cancer treatment, they're more of a high risk patient. We're going to need interventions that are for someone who is not necessarily as resilient as the average person. And that's what I kind of like to work with, is where's your resilience level? How can we boost your resilience? So I would say someone who is more resilient, who's not dealing with cancer, whose baseline is pretty healthy, all their labs look great, they're able to have a little bit more wiggle room. They're able to go eat out at a restaurant 1 to 3 times a week and it not really be an issue. Whereas someone who is going through major treatments, someone who is essentially having illnesses, infections, cancers, they really need to hone in. So that would be eating all your meals at home or getting a home delivery service. That's where kind of asking for support and help is great. But you want to stay away from those inflammatory foods, those inflammatory seed oils, all the excess sugar that is added to these restaurant foods, and just essentially eating real whole foods that come from the earth, come from animals, but making sure it's high quality. That's kind of the conversation I have with most of my individuals, is there's a big difference between getting a burger from McDonald's versus making a 100% grass-fed, pasture-raised burger at home. So you can still enjoy the foods you like, but improve the quality so that they're going to work for you. And then really honing in on minerals, because a lot of times when someone through all of these treatments, they often don't want to eat. Someone who's going through chemo, a lot of times they lose their appetite. So that's where I think supplementing and kind of doing, like, whether it's protein shakes or greens powders or just little things that kind of bypass the eating process for people who are just not able to consume adequate amounts, because we really want to get those minerals in there. So that's kind of, I think, the baseline of the dietary needs. And then nutrition is everything you consume. So working a lot with people just to make sure they're kind of feeling a little bit zest of life, hunger for life, even during treatment, during such a hard time, to make sure that they just kind of feel at home in their body and connected with the world around them. So that's kind of the mental aspect that I'll sometimes work with people on.
But it's amazing when we understand how important good nutrition is. I think a lot of times we select the food we eat based on the smell, based on the color, based on the taste, but a lot of times we eat a lot of empty calories or, nutrient poor food.
Absolutely.
So tell me, Ms. Shaw, what changes have you made in terms of your exercise, your physical functioning, and your nutrition since being diagnosed with breast cancer?
A lot, because my cancer was estrogen progesterone positive. And I was going to ask you about when you said something about. I know so many different seeds that you can eat. Chia seeds and different type. I know you said something about seeds. So which ones should I be staying less away from?
Saying seed oil, different thing. So essentially the oils that are derived from like intense processing of these seeds.
Okay.
Again, if someone's really healthy, occasional exposure is going to make or break their health, but someone who is more at risk, that's in. As far as being estrogen dominant and kind of honing in on a diet that's more supportive, I think there's just so much contrasting literature out there. That's kind of the hard thing is I've gone through 2 conventions where some people are saying how eating more estrogen-like foods, so phytoestrogens, actually is super preventative of even estrogen dominated cancers. So, or just helping menopause, how good estrogen, phytoestrogen foods are for you. So it's kind of hard to say. I'd love to hear Dr. Horning's view on this because I see so much conflicting literature on it. And in my experience, I just try to get people to really eat a balance and not go too crazy on one end. What is your experience with kind of those estrogen dominant foods?
Thank you. 2 parts. One is I often will partner with a licensed nutritionist, dietitian, someone who truly has a degree. I think that's really important when we're looking at everyone's unique. Everyone has their own like health makeup. And so I think really having a team approach is needed. So for instance, some people might have had Lyme disease or might have had some autoimmune. And so I think it's really important when we talk nutrition that we look into that expert level. The other thing that I like to look in is sometimes it's just a real opportunity where, especially since this is often a female dominated condition, not always, we really look at like, how are we taking care of ourselves? And sometimes a person who's been taking care of other people and has been kind of focusing on lots of other things, it's a real opportunity where one can really look at what am I taking in? What am I doing for myself? And I have seen some survivors just shine in this opportunity to kind of take back their life and take back their fitness and take back their choices and start saying no to things and really like kind of have an opportunity to check what's important to them. And so I've seen individuals lose body mass index of significant gain, muscle mass, which not only has been shown to help decrease reoccurrence, but also decrease lymphedema. There's some excellent evidence looking at 150 minutes of aerobic and resisted exercise per week. So that's about 30 minutes, 5 days a week, has been shown to minimize the risk of certain cancers, but also the risk of reoccurrence in multiple cancers. And the research is coming out more and more and more. So I kind of more take it as, all right, like, where are we at? What are we willing to change? But then really looking at this opportunity to make yourself as healthy, the healthiest you've ever been. And for many of my individuals, I see their health flourish after and during treatment.
Yeah, because that's what she asked me what I do. But at first I was really scared because when they said estrogen positive, then they was saying all organic foods, different stuff. So I was losing weight in the beginning because I was so scared to eat and what I shouldn't eat. I knew that I had to keep my stress level down. That was important. So I have slowed down working out because been a caretaker for my dad, and it's been, oh my God, he just passed away, and I've been really overwhelmed with taking care of him. So, but I do have a system as far as when I do work out, I try to work out as much as I can. I do Zumba, and I am a Zumba instructor. I haven't had any classes, but I do Zumba. Also, I joined a Massage Envy, which is like a monthly massage. So I did get different massage. I do everything to try to keep my stress level down because I do work in media and it's very stressful. I have a very stressful job. So I do a lot of things to try to keep my stress level down, change my diet. And I just took a certification in holistic nutrition. So I'm trying to incorporate my diet to be plant-based and try to slowly go to vegan because I do have an issue. Dr. Marshall keeps telling me about, I don't know why, but it's weird because it's like now I've lost so much weight and I'm like, why is my cholesterol? What is it? I don't know if it's inherited or what, but my cholesterol, I can't get that like in a level that I get it to. Other than that, I try to do everything I can to keep my stress level down. I even incorporated a nonprofit, which stands for Maine Mammograms Is Not Enough. So I help women who, have breast cancer, who don't have breast cancer, and who can afford different treatments for a diagnostic screening, since my actual diagnosis was caught on a diagnostic screening. So I created a nonprofit, and I try to do as much as I can to be a blessing to others and try to live a good level life. So that's what I'm trying to do. And like I said, right now I'm just trying to incorporate, like my diet, eating a lot more better, and hopefully eventually transfer to being a vegan and all plant-based. It's like a transition, but that's my goal.
And, I'm so proud of you, Ms. Shaw, because, we understand the hills and the valleys that you've been through along your journey. But what is most important for cancer survivors and survivorship is the moment you are diagnosed with it and you finish treatment, you are a survivor. Right? And the other thing that we need to think about is, how has our life changed? How do you view the world after the diagnosis and treatment? And what I have seen with countless of my patients, they tell me they look at things with different lenses. A lot of times they say, you know what? I take the time to stop and smell the roses. I take the time to look at me, see what my body needs, make sure I make decisions to eat healthy, make sure I make intentional decisions to exercise, make sure I seek after my care, because, this is a second chance of life, and you live each day to its fullest. And what are some of the things you have to tell your patients, Dr. Horning, to encourage them after this journey of breast cancer?
Excellent. I would say early on. So, near when they're diagnosed, I often talk a lot about like who's your tribe, and really getting individuals to feel comfortable for letting people help them. And then once, for instance, if you're always making lunch for your child, okay, but they are definitely able to make their own lunch and not taking it back. You know what I mean? So like finding the things that other people can help you and that not taking it back when you're done. Many individuals work really hard, right? And when they have to go out for treatments or they take a little bit of time off of work, somehow the work gets done, right? Very rarely does a company go out, like go under because you had to go out for, you know what I mean? And so helping when they go back to work, not to get back into some of those stresses and things like that. I think that's a lot of the stuff we do. And then a lot of things that we do is, when are you going to exercise? So not like we know you should exercise, but actually like putting it into a schedule and a routine. In the morning, I do this and I do this, and then I have a 30-minute window. And now I'm going to watch the news while getting on the Peloton. And so really like helping people make it part of their routine. The Strength After Breast Cancer program, which I had spoke about earlier, one of the real cool parts about it is all you need is some hand weights. So it's very accessible for individuals. It's very cost effective. You can do it at home. You can do it at the gym. And so like you can do 20 minutes every day. You could do 3 times a week, all of the exercises. Like, how can you actually make it work? I take my kid to a doctor's appointment on Wednesday mornings, and that's when I walk. So I know on Wednesday mornings at 8 a.m., I'm walking, unless it's really rainy, but I'm walking. So I know I'm going to get my walk in, because once I start treating, I don't know how my day is going to go. And so helping individuals like carve out that time, because then that can be permanent. I've been a physical therapist for a long time, and I believe in it, but I really believe in how we can change individuals' like patterns. A lot of times I can work on you and you can feel good for the hour that you're here, but like, how can I help Dr. George do her stretches on Saturday? Like, how can we change that so that this isn't something that happens again? So that's a lot of the things. So like it or hate it, if you've been a patient of mine, I do a lot of like, talk me through when you're going to do this and how, what equipment, what time, like, how can this actually happen?
I like that because it forces people to be intentional. Right, Miss Philly? You're not going to just say, I'm going to do it. You're going to say when you're going to do it, and you make them accountable for it. I really like
commitment. That's a good way of doing it. Yeah.
That's a good way. So, Dr. Horning, how it is someone can get access to your program? If there is a breast cancer survivor or someone newly diagnosed and they're listening tonight, or they have a family or a friend or someone at their church or in the community, and they heard about this program and they want to refer them or tell them about it, just walk me through the process.
So cancer rehabilitations, there are physical therapists and occupational therapists. Our company is housed by NovaCare, but there are other cancer rehabilitation therapists throughout different hospital systems in the area. So you want to look for a therapist who has had specific cancer rehab training. And that's very important because they need to understand what is a lumpectomy and they need to understand what is radiation or chemotherapy and how that affects the body. In Maryland, it's an open access state, which means you can come without a doctor's prescription. That being said, I really believe in a team approach. So many times I like to actually get a script or an order or kind of a A-OK by your team. And I often like to have the medical records so that I can really understand the full story. Some patients come 2 times. I've had patients that are interior designers and they're doing great, but they just want to make sure that they can reach overhead. Sometimes I see individuals that have a long road ahead of them, and we walk them through reconstruction and surgeries and reoccurrences and everything. So sometimes I'll see patients for years. I have a patient who's with me still. She's had metastatic lung cancer for multiple years now, and she is such a fighter. So I continue to treat her off and on as needed. But revitalcancerrehab.com, it has a location link. So you can go there. And then I can also leave my email for anyone who may be interested about that discussion.
Okay, beautiful, beautiful. So, Ms. Shaw, if there's one message as we wrap up our program today, if there's one message you want to share with our listeners about what it is like to go through breast cancer and come out on the other side, what would be that message?
I would just say, as hard as it is to hear that you have cancer, you just have to just trust and just know that you can come out on the other side. I mean, it may be hard, but trust, have that. It's good to have that support, have that encouragement, and just like the program that Dr. Patty Horning has. I mean, that's something that that can help you with your journey. So it's important to have surrounding people to support with your journey and trust and believe and don't give up the fight like I did. And early detection is the key. And if it isn't caught early, I always say don't give up, to persevere, because you will get to it on the other side. You will get to the other side. Just to continue to be strong and be encouraged.
Yes, I'm so happy. 11 years survivorship.
Congratulations.
Congratulations.
Thank you.
Beautiful.
I'll turn it over to my co-host, Miss Tilly, to wrap us up.
Yes, thank you so much, both of you. Katrina, your story is beautiful. I hope you actually make an appointment with me now. Maybe we can talk about this
Yes.
again. But this has been great, and thank you so much for your expertise, Dr. Horning, and just the work you guys are doing is really, really incredible. So I hope people out there definitely find their way towards you so that they can receive care that not only helps them treat it, but helps them thrive. And that's what I love. Let's not just survive, let's thrive. And that's
Right.
so thank you so much for both being here. Thank you, Dr. George, for bringing us all together once again. And hopefully we'll all see each other soon.
That was one of the best things too. I had the most awesome doctors. I mean, it's great to have when you're going through that journey, to have that connection and have the doctors, because Dr. Marshley, she was, I mean, after I finished my journey, and then she left John Hopkins. I searched for her. I said, I was like, I don't know where she is or where she went, but I found her.
Yeah, I'm just now, I'm no longer doing clinical work at Hopkins. I just adjunct faculty. I do research and other type of evidence-based work. So I'm no longer practicing clinically. So she found me.
Yeah, and that's what I'm saying. That's another thing I can say. That's so important. When you get diagnosis, to have the doctors, the concern and the support. I mean, that's like over and beyond important.
Well, you're very inspiring and you help give a lot of strength to individuals who may have recently got diagnosed or about to start their journey. And you can't help but think like, will I be able to blah, blah, blah again, or will I be able to? So thank you for sharing your strength and also your help for other people. It is a lot of financial toxicity with this disease as well. And we still have a lot of disparity, not only in the African American community, but also the Latin community. They are 66, significantly less likely to get cancer rehabilitation and other needed services. So thanks for also giving advocacy out to the community so we can help all individuals affected by breast cancer.
Thank you, and good evening, ladies. And tune in again for another Health Talks by YWS. I'm Dr. Marsha Lee George, and my co-host is Miss Tilly Mirsky. Have a wonderful evening. Bye.
You got your projects going on, come on, work it out. What? Come on, work it out. Come on and work it out. See, health is wealth, come on and work it out. You at the gym right now, come on and work it out. See, health is wealth, come on and work it out. Yeah, come on. It's about you and me. Let's come together, positivity. It's about me. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change but me. So let me put in the work and be the best version of me.